So today I'd like to talk about our 2-year prospective clinical trial for the treatment of uterine fibroid using a brand new portable ultrasound guide HIFU with 3D electronic steering and targeting forecast function. When you compare MR guide HIFU and ultrasound guide HIFU, ultrasound guide HIFU has advantage in terms of real-time imaging, cost, and availability. When you review the efficacy of ultrasound guide HIFU for the treatment of uterine fibroids, the 3 months volume shrinkage rate ranges from 17% to 46%. Commercially available ultrasound-guided HIFU for the treatment of abdominal organs are usually big in size and fixed in location so that they occupy large space. We developed a new design, compact size ultrasound-guided HIFU for the treatment of uterine fibroid through 6-year collaboration of our hospital and an ultrasound company. It is compact in size and portable. The occupying area is about 1/3 of commercially available ultrasound-guided HIFU. It has an easily adjustable treatment head, as shown in this slide, which is easily adjusted by hand. This slide shows how compact this machine is. It has a multi-channel 256 phased array transducer. Using electronic steering, it provides 3D volumetric treatment zone without movement of treatment head, with axial diameter of 5 centimeters and lateral diameter of 2.6 centimeters. For the treatment planning and targeting assurance, it provides targeting forecast function, which provides information on the location of real focus by insonating weak pulses. It also provides interleaved image display, which enables continuous visualization of target lesion during treatment. This animation clip shows targeting forecast function using weak pulses. It shows the exact location of real focus of HIFU beams. It is very helpful for targeting assurance. This animation clip shows real-time monitoring by the help of interleaved image display. You can see occurrence of color change within the tumor. It is helpful for treatment monitoring. So we performed a prospective study to investigate the clinical efficacy and safety of this portable HIFU system for the treatment of uterine fibroids. It is approved by our institute, ILB. This slide shows inclusion criteria and exclusion criteria, which are very similar to American FDA for the approval of MR-guided HIFU for the treatment of uterine fibroid. We finally included 59 fibroids of 36 patients. Mean age of patient here. HIFU treatment was performed by one radiologist. The default parameter is as follows. In first year trial, we performed contrast enhanced MRI was performed before HIFU, immediate after HIFU, 1 month, 3 months, and 1 year after HIFU treatment. Whereas in second year trial, contrast enhanced MRI was performed before HIFU, immediate after HIFU, 1 month, and 5 months after HIFU treatment. We analyzed non-perfused volume and non-perfused volume ratio at immediate MRI, treatment time and treatment speed, mild volume change at follow-up MRI, and symptom and complication. There is an example. You see a big tumor within the uterus. You see completely oblated tumor on immediate MRI. It reduced in size over time. There is another example. You see a big tumor within the uterus. You see it is completely oblated after HIFU treatment. It reduced in size. This slide shows immediate non-perfused volume, ratio, and treatment time. So in total, immediate non-perfused volume ratio was 74.4%. Treatment time per fibroid was 44.6 minutes. This slide shows tumor volume shrinkage rate. So you see 1 year tumor volume shrinkage rate in first year study, 43.7%, whereas in second year study, 5 months tumor volume shrinkage rate was 45.9%. So we can say that the tumor volume shrinkage rate reaches about 50% 5 months after HIFU treatment. This slide shows pain scale and life quality improvement. So you see a VASA score and uterine fibroid symptom and quality of life and symptom severity score all were improved with statistically significance. Adverse event, there was no big major adverse events except a minor rectus muscle heat injury in 3 patients. When we compare our result and prior ultrasound-guided HIFU studies, 3 months volume shrinkage rate was comparable between our result and prior ultrasound HIFU studies here. When we compare our result and a result from MR-guided HIFU using volumetric ablation, immediate non-perfused volume and treatment speed are also compatible between our result and volumetric ablation of MR-guided HIFU treatments. So in summary, ultrasound-guided HIFU for the treatment of uterine fibroids are effective and safe, and compact design HIFU unit works for the treatment of uterine fibroids. Thank you for your attention.
Any questions? I think that's really impressive data, and the machine looks beautiful. It looks great. Can you talk a little bit about how you detect if there was bowel in the way, or I'm pleased to say that you have no bowel injuries. I'm very happy, but can you talk a little bit about how you can use ultrasound and make sure that you're safe?
Yeah. So before HIFU treatments, we evaluate MR image and ultrasound image together. So ultrasound image is very helpful to see the location of bowel. So there is no problem to avoid volume damage.
And how
bowel
many,
damage. Yeah.
And how many of those patients did you need some bowel mitigation strategy to move the bowel out of the way?
Okay, I'm not sure how many bowel interposed between abdominal wall and uterus, but we using bladder filling and lactus filling, so yeah, there is no problem.
Great, great.
Okay.
Oh, thank you. Very interesting. Okay,
Thank you.
Thank you.